this is that person, and this calculation is done for this person, like this exactly, and we won't apply this to anybody else.
I know that you said you took out patients from the study that had certain conditions, so say if they had carotid gland surgery or something like that. So based on that, I'm assuming that you're concluding that this research is the saliva loss is due to the radiation therapy and nothing else?
That's right. That's what we're hoping to isolate.
Okay. And that was done using just eliminating the patients based on.
Yeah, easiest way to account for it. Just to get rid of the patients that factor changed.
Okay. So in terms of just cancer treatment, so things like chemotherapy, where does radiation therapy stand? So in terms of popularity, in terms of effectiveness, where does radiation therapy stand compared to other?
So I'm not an expert exactly on chemotherapy and other modalities or treatment options, but you know that radiation therapy is quite cheap compared to chemotherapy, and it's also fairly quick and can also be quite localized. So if a patient has a tumor somehow on like the periphery of their body, it wouldn't really make much sense to have chemo because that would be a whole body treatment. Whereas radiation therapy, you can target that region and kind of isolate it to the region.
I'll put in that it's site dependent, right? So someplace the efficacy is really great, and some it's not. But all of these things kind of fit together. So it's optimized depending on what's essentially what's best for that patient. So I think probably still the primary method of curing most tumors is surgery. I believe that's followed by radiation therapy as what's considered the primary cure, and then chemotherapy, which is sometimes given as adjuvant, but in some cases it's the primary cure as well. And each of these things has their place, like depending on where you get it and what the type of cancer is, and that kind of thing. I agree with my grad student that it is relatively inexpensive compared to some of the other modalities, but that is not the primary reason for a decision. What they do is they do radiation therapy where radiation therapy is best. In this type of treatment, it works quite well.
So for head and neck patients, would it be radiation therapy, or does that also depend on where the cancer is located?
So these folks will either get they'll get a combination of radiation therapy and chemo, or radiation therapy, depending on that specific patient, their cancer, the extent of that cancer, and that kind of thing.
Is there much surgery that happens?
I could not comment on the amount of surgery that happens for a head and neck cancer.
How does the radiation therapy, how does it work? Basically, does it kill the cancer cell but not the normal cell, or?
So this can be very complex, depending on how you're looking at it. But the idea is you have to take this. I mean, it's specific depending on the type you do it, like the type you look at it. But generally, the common thought is you do DNA damage to a cell, and if you do enough DNA damage, the cell can't repair. So if you get the dose high enough, the cell won't repair and it will die. You have, again, depending on how you administer it, you have a number of other things going for it. Generally, you have healthy tissue will repair better than cancer cells. So depending on how you give it, you can kind of allow healthy tissue will keep repairing itself while the cancerous tissue won't be able to. So you can give close to the same amount, and the healthy tissue will recover, but the cancerous tissue will not.
So the recovery itself is, it can recover if it's not damaged, but if the DNA is damaged, then under mitosis is when it can no longer proceed, and it's just apoptosis. So the cell dies. That's how the actual cell death occurs.
So the cancer cell are more likely to die as a result of radiation therapy compared with the normal cell.
It depends on how it's administered. So we also administer a different type of therapy where essentially you kill everything in the volume, but we know everything within that volume is cancerous, so we'll apply it differently. What we'll do is we'll increase the dosage, and this, like for some small lung cancers, this has been also very successful. This type, but for this type of treatment, we do rely on a kind of fractionated approach.
So just to maybe clarify, if the patient volume is like this, like a cross-section volume, we'll send a beam through like this, maybe one direction, send another beam like this, send another beam like this, send another beam. And if the tumor is in this overlap region, then they receive a lot more dose. Or the tumor receives a lot more dose there. But because the beams are spread out in the normal tissue, they receive a lot less dose. So less cells will die there, but because of the beams overlapping there, there's high dose in that region.
And normally, how many times do the patient need to undergo this treatment before it is finished?
Generally, it's 35 fractions. So they come by 35 separate times for treatment, not including the initial planning stages and checkups.
35 times, like in the duration of how many days?
I believe it's 5 days a week.
For this, 5 days a week, yeah. So they come every day. It's about 15 to 20 minutes, including, like, in this kind of case, because we're there's a lot of setup. So we do a lot of things, like we also will image them while they're on the bed. So the getting geometric accuracy on this, like making sure they're exactly in the same position as how we plan them to be is quite important. So 35 times and about 15 to 20 minutes per time.
1 month and a half.
Could stem cell be a solution to this problem, maybe into the future? That's
sorry,
far away, is it?
No, it's actually, I don't, it is not that far away.
Oh.
The efficacy of it is still under, like, debate. So you're talking about for the parotid or
Yeah.
for the cancer itself?
The sublingual or any other tissues that secretes the saliva?
Yeah, so this kind of work's been done in rat in the rat model, not by this group, but this was also one of the this idea of a heterogeneous response for the parotid comes from part of it comes from some work that was done with stem cells.
Okay.
So if we're lucky, we can figure out a way to do it without, but doing it with it's being worked on.
Okay.
So it might be an option. It might be the best option, or it might be an option that we don't need to do.
So if after the 35 treatment, if the patient doesn't respond well, do you continue or you just stop it?
Yeah, no, we have, so after the treatment, the patient's monitored, and if they do come back, they can be retreated. It depends. Like, everything on this is catered to that individual patient. But for this specific treatment will not go beyond 70 gray, which is our our measurement of radiation and in 35 fractions.
I was just wondering, has the xerostomia actually caused patients to stop taking treatment, or in any case that you've noticed? Reduce?
I wouldn't, unfortunately, just because of my job, I'm not privy to that. So that's the conversation that they would have with the MD that is working with us, Dr. Wu. I mean, he could answer this, but these would always be in consultation with him, so they never come see. They never come see me to talk about their.
Although I've heard fluoride gels and things that are prescribed, so maybe I of course don't know either, but I think my impression would be that they would continue along and just treat the symptoms as needed for the prospect of killing cancer, of course.
Do you guys have any questions?
Is it possible for us to look at the equipment for you to do the radiation?
Sure. We can.
I did clear that feature.
Okay, great. So what we'll do is we will, we can go down, and is it okay? I will run down first.
Yeah.
Sure.
So I cannot tell you how important that this patient's privacy is maintained. It is. It's important to them. It really is very important to them. So we won't, like what we'll go into a place where they're not, hopefully, and I think we should be clear on most places, but we'll be really sensitive about how we take a picture, because just in case there's a name that's written for some equipment.
For sure.
And if you, like, when you're going through, if you see something that is any name at all, really please be sensitive.
Yep.
Should we just
So I'm just going to do a quick run.